Okay, I thought we got rid of this guy. How did he get back on the stage? Okay, guys, I have another joke for you. Another joke for you. What do you call a kidney that's a great musician? An organista. Okay. That one didn't hit. But here we go. Why did the kidney apply for a loan? It wanted to start a small stream business. Okay, security, can we get this guy off the stage? And this time lock the doors, no more. Good day to everyone. We're gathered to delve into the topic of nephrolithiasis, more commonly known as kidney stones, a prevalent condition affecting individuals across the globe. This lecture will explore the pathophysiology, clinical presentation, diagnosis, and management of kidney stones. Nephrolithiasis refers to the formation of stones within the renal system, primarily within the kidney. Stones arise from the crystallization of substances in the urine, which may include calcium oxalate, calcium phosphate, uric acid, struvite, and cysteine. The formation of stones is influenced by a variety of factors, including supersaturation of urine with stone-forming constituents, inadequate urinary volume, and abnormal urinary pH. Kidney stones are a common urological problem, with a rising incidence possibly due to dietary and lifestyle changes. They affect approximately 1 in 11 people in the United States, with a higher incidence in men compared to women. Now, the risk factors. Several risk factors contribute to the development of kidney stones, including dehydration, low fluid volume intake leads to concentrated urine, diet, a high intake of salt, oxalate, and protein can increase the risk, medication or medical conditions such as hyperparathyroidism, renal tubular acidosis, and certain metabolic disorders can predispose individuals to stone formation. In family history, there is a genetic component with a higher risk if family members have had stones. Medications, some drugs such as diuretics and calcium-based antacids can promote stone formation. Now, how do patients present with kidney stones? Patients with nephrolithiasis can present in various ways, the most common being acute onset of severe flank pain radiating to the groin, known as renal colic. Other symptoms may include hematuria or blood in the urine, nausea, vomiting, and urinary urgency or frequency. But how do we diagnose kidney stones? The diagnosis of kidney stones involves a combination of clinical assessment and imaging. Non-contrast CT scan, abdomen pelvis, is the gold standard for detecting stones. Other diagnostic tools may include ultrasonography, which is particularly useful in pregnant patients, and plain abdominal radiograph, or a KUB, which stands for kidneys, ureters, and bladders, which can visualize radio-opaque stones. Urinalysis can support the diagnosis by demonstrating hematuria and crystalluria. A metabolic evaluation including 24-hour urine collection can identify underlying metabolic disorders and recurrent stone formers. The management of kidney stones depends on their size, composition, and whether they are causing obstruction or infection. Conservative management, most stones less than 6 millimeters pass spontaneously. Conservative treatment includes pain management with NSAIDs, or opioids, but primarily NSAIDs, and medical explosive therapy with alpha blockers. Surgical intervention. Stones not likely to pass are typically greater than 6 millimeters, causing persistent pain, renal dysfunction, or infection require intervention. Options include extracorporeal shockwave lithotripsy, ureteroscopy with laser lithotripsy, or percutaneous nephrolithotomy. Preventive strategies focus on addressing the modifiable risk factors, including adequate hydration, dietary modifications such as reducing intake of oxalate, animal protein, and salt, and medical therapy for underlying metabolic disorders. In patients that recurrently have stone formation, specific medications such as thiazide diuretics, citrate supplements, or allopurinol may be indicated based on stone composition and metabolic evaluation. Nephrolithiasis is a condition with significant implications for patient well-being and healthcare resources. Timely diagnoses and appropriate management are critical in providing relief and preventing reoccurrence. Now, back to our previous show. Okay, we finally got that comedian outside of the building. I don't think he's coming back anytime soon. No, sir. Is that him? Wait a minute. Wait, can we stop the show for a minute? Is that him outside the door trying to tell a joke? Why did the kidney apply to art school? Because it wanted to master the fine arts of streaming. He's still going, guys. He's still going. What did the left kidney say to the right kidney when it was time to work? Urine it to win it. Oh my gosh, my side. How do kidneys listen to music? By streaming their favorite fluid tunes on their renal network. Oh my goodness. Okay, this guy. Security, can you escort that guy to the street? Thanks. That's all for this show. As always, keep your head up. You're doing great. You're better than what you were yesterday. That's a lot. Learn something new today. Gonna be a great doc. Sometimes you just gotta hear that.